Reversing Alzheimer's disease and cognitive decline. Now, I know if you're like me, when I was in school, we were told that that is not possible, but actually it is possible. And we're going to talk about that tonight. So let me ask you, and you can type in the chat box if you want to, why are you here? Just let me know. So you're either here for yourself. Some of you filled in the little poll that I had when you signed up for the webinar. Your mom has Alzheimer's, okay. Yes. So we see this quite a bit. And then what can happen is we also worry about, you know, if it's happening in our parents or our grandparents, is it happening to us? And thank you for the Parkinson's. And what we see is that, you know, we tend to separate Parkinson's from cognitive decline, Alzheimer's, dementia, whatever word you want to use, but they are all different forms of neurodegeneration. And what you do to fix one, you do to fix all of them. There's little subtleties there, but you do that for all of them. Okay, so if there were a way to prevent Alzheimer's disease and cognitive decline, would that be important to you? What I want you to do is just take a little piece of paper, or I hope maybe if you're taking notes, there'll be some things for you to write down as we go along. Write down a number between 1 and 10. How important is it to you to take care of this, either for your loved one or even for yourself? You know, Dr. Bredesen says, everyone knows someone who has survived cancer, but no one knows anyone who has survived Alzheimer's, and that's until now. And we are seeing Alzheimer's disease reversed. And actually, I'm going to show you some results, some lab results a little later on, where a person started with us last summer. She had a full-on diagnosis of Alzheimer's. She no longer qualifies for an Alzheimer's diagnosis, okay? Now, I like this quote because I want to get you sort of in a little bit of a different mindset. You never change things by fighting the existing reality. You change something, you build a new model that makes the existing model obsolete. That's a great quote. In order to move forward from what we're going to talk about in a little bit as 20th century medicine, and I don't mean that in a derogatory term, it's just a mindset, we have to adopt a new way of looking at chronic disease. So let me tell you why I do this. That's me and my family. I'm obviously the one with no hair, and 3 of my 4 grandparents died from cognitive decline. My wife's dad died just a few years ago, and he was suffering from it as well. And so this is a very, very real thing in my family. And so that is why this is important to me. Just a little bit about me. Anybody that attends the webinar tonight, if you'd like, I will send you my slides. But I graduated from Baylor in 1979, and I can tell you that was long before Baylor had good sports teams. So we just got beat by everybody. I taught electrical engineering for several years. I had raced bicycles quite a bit, and so I was very health conscious. I decided I wanted to go back to school and become a doctor. So I went to the National Health Sciences University in Chicago, and I got my chiropractic degree. So that's my first doctorate. To me, chiropractic was like the application of Newtonian physics to people. If just something's out of place, you just, at a certain angle, velocity, and amplitude, you put it back where it belongs. And it's like lining up the front suspension of a car. Early 90s, the opportunity to move to Europe came along. My wife, her dad was career Air Force fighter pilot. I mean, he was the real, you know, the real deal. He, not Top Gun, because that's Navy, but he was every bit of that. And so she grew up in Europe, and the opportunity to move to Holland came along. While we were living there, I did a diplomate in neurology at the Carrick Institute in Amsterdam. I've done a lot of other neurology things, a lot of brain-based stuff. About 7 years ago, I developed a problem with gluten, and I, or none of my doctor friends, really even knew what gluten was then. Of course, you hear all about it now, but go back 7, 8 years, and we weren't talking about it very much. And I developed this thing called a leaky gut. And I didn't even know what a leaky gut was. As a matter of fact, I used to tell patients to get off the internet because there's no such thing as a leaky gut. Well, there is. So I did a functional medicine course with the Kalish Institute. I'm a fellow of the International Board of Functional Neurologists, and so on and so forth. So that's enough about me. I want to split tonight's talk into a few sort of subcategories. The first thing I want to talk about are the facts. And the second thing we'll talk about is the bad news. Then we'll talk about the good news. And then we'll talk about what you can do to take care of this problem. So just a few things. A lot of people are not aware that Alzheimer's is the third leading cause of death now in the United States. So somebody type in, what's the number one cause of death? Anybody? It's heart disease, right? Heart disease is the leading cause of death in the West, or in North America. And the second leading cause of death is cancer. And third is Alzheimer's and dementia. I didn't realize this until I went out to California several years ago to train with Dr. Bredesen at UCLA. Dr. Bredesen is one of the main doctors that has put together our understanding of what causes cognitive decline and how to reverse it. And I did not appreciate that the primary burden of Alzheimer's and dementia falls on the caregiver. I had 3 of my 4 grandparents died from this. However, Lenine and I, that's my wife, we were living in Europe most of that time. And so it really didn't affect us. We really didn't realize how much it was affecting our family. So Alzheimer's is now the only one of the nation's 10 most common causes of death for which there is no effective treatment, at least no effective treatment from the old way of looking at things. Few other facts: every 65 seconds, someone in the United States develops the disease. 18.5 billion, that's not dollars. You want to say $8.5 billion, but it's actually 18.5 billion hours of care. Now, I don't know about you personally, but most of the people that are listening this evening are probably of a generation that remembers when the average middle-class family could exist comfortably on one income. And I can't explain the economics of everything, but what we now know is that for most families, it takes 2 incomes. And so when somebody falls down with this, with dementia, Alzheimer's, cognitive decline, and someone ends up having to, give up work and stay home and take care of them, it has a huge impact, a really big impact. This is what the American Alzheimer's Association says. Dr. Bredesen says it's quite a bit more, but we'll just leave it at this. $350,000 and change is what it costs to take care of somebody with dementia as of 2 years ago. Now, there's not a new number out, but I can tell you it's probably gone up significantly from that. The reason for this is there's several. First of all, from the date of an actual diagnosis of Alzheimer's or dementia, the average patient will live about 10 years. And the majority of those years will be spent in some sort of assisted living, whether it's at home and you're having to bring people in, or someone's had to give up their job, or you put them in an assisted living facility. And so this ends up costing quite a bit. Families end up paying about 70% of this out of pocket. Medicare does not pay for personal care at home or in assisted living, and its nursing home benefits are limited to just 100 days. So there ends up being a huge gap between what insurance will take care of and what families end up having to take care of. Unfortunately, most families are not prepared for this when it happens. We all think it's going to happen to somebody else, but not us. So the most expensive disease in history is turning out to be Alzheimer's and dementia. 1 in every 3 seniors dies with Alzheimer's or some other form of dementia, and 66% of those are women. Now, here's a lot of people don't understand what's causing and driving this problem, and we'll get to it in a little bit. The reason women outnumber men 2 to 1 when it comes to dementia is, yes, they do live longer, but that's not really the big reason. The big reason why women outnumber men when it comes to dementia is you have more triggers. And we're going to get to what we call the holes in the roof, or the things that cause or drive Alzheimer's. And one of the categories has to do with hormonal changes. And what happens, of course, in women is you have a lot more profound hormonal changes than men do. So you have puberty, which can be very dramatic and upsetting at the time that it happens in your life. And then after puberty, you go on and you have children. And some of you have had more than one. And, I was there when my wife delivered, and I can tell you, I don't know if I'd have gotten past one. But, and then after you have children, you go through menopause. These are huge hormonal shifts. And these types of things will drive the cognitive decline. And we'll get back to that in a little bit. Between 2000 and 2017, deaths from heart disease went down. So we are very slowly winning the war on heart disease, but deaths from Alzheimer's went up 45%. As a matter of fact, if we come forward from 2017 to now, it's up above 150% increase in deaths from Alzheimer's. So let's talk about the current situation, or what I call the bad news. Now, I'm going to ask you to stick with me with this. By the way, let me say this now, in case I forget to say it for a little bit. For staying with me tonight, when we get to the end, I'm going to show you how you can get what's called a Cambridge Brain Sciences Cognitive Assessment. We'll send you a link. You can do it at home. You'll get a full report that will go through your everything that's going on cognitively with you. And if you'd like to talk with me about it, that's fine. We can sort that out. But just stay with me to the end, and we're going to get you a link to take a Cambridge Brain Sciences test. So the bad news. Sometimes I show a video clip here, but we're going to try to keep the timeline moving a little quicker tonight so that, because I know you have other things to do. But I don't know if anybody remembers this. This happened just last fall. Biogen, one of the big pharmaceutical companies, it became obvious that they were not going to be able to move from what's called stage 2 trials to stage 3 trials. When they announced that, their stock prices went down 88% in one day. The company, or the $88, they lost 27% of the value of the company in one day. That turned out to be an $18 billion loss. Now, however you want to look at pharmaceutical companies, they are in business to make money. And if they can't make money, then they're not going to expend their resources in that direction. They'll go find something else that they can that they can discover and create and whatever, and get out to the public. So what we're seeing now is, if you watch the news on this, every time you turn around, there's another drug company that is failing, and they're pulling the plug on this. Eli Lilly's shares tanked after the Alzheimer's drug failed. AstraZeneca as well. You've got Pfizer. You've got Roche. You've got Merck. These companies, they've stopped looking. And so, we've sort of all grown up with this idea that sooner or later, they would find a cure for whatever it is that happens to be going on. We have a current situation right now where we're desperately, trying to develop some sort of a cure. And when it comes down to it, is the strongest thing that you can have is your health. For our current situation, the most profound thing to help you through this is a robust and vibrant immune system. So what we see is these drug companies are pulling out. This was just in the New York Times just last month, where another treatment has failed. For 5 years, on average, the volunteers received monthly infusions or injections, 2 of the experimental drugs, along with annual blood tests and so forth. And the verdict is in: the drugs did nothing to slow down the cognitive decline. As a matter of fact, a genuinely new Alzheimer's drug has not been approved since the year 2003. And of course, the currently approved drugs, the medications, they're ineffective at stopping or slowing the disease. And I was just reading something from the Journal of the American Medical Association a few days ago, where they're actually showing that Aricept and memantine are actually accelerating the decline. A record number of FDA approvals occurred in 2017. We have not had a new drug for Alzheimer's in now what's coming on 17 years. And when you're talking high tech, and this kind of stuff. 17 years is a lifetime. If you want to know what was 17 years was like in tech, what kind of a phone were you using 17 years ago? Just think about it. One of those little flip things, right? And if you wanted to, you know, call somebody or send a text or something like that, remember you had to push the button with the A on it 3 times just to get to the C. And so it's complete, you know, the technology has been moving along at a lightning fast pace, but we haven't seen a new drug for Alzheimer's now in 17 years. That's a long time. This is the article I was referring to in the Journal of the American Medical Association. Participants receiving concomitant medications for dementia due to Alzheimer's disease show faster rates of decline. That is just shocking. So why has Alzheimer's treatment failed? Well, Alzheimer's research has been based on the hypothesis that the disease is caused by the buildup of amyloid plaques in the brain. Now, you've probably heard of amyloid plaques, and the traditional assumption that Alzheimer's is a single disease. And this goes back to, well, let's go to the next slide first, and we'll explain why this is important. The 20th century medical model is based on what we call a monotherapy. Now, like I said before, this is not being said to be critical or judgmental. It's to try and help us to understand exactly why the situation is the way it is. So prior to 1942, the #1 cause of death on the planet was infectious disease. In 1942, a woman named Wilson up at Yale Hospital was the first person to ever be given a what? Who knows? Somebody want to type something in? Want to take a guess? Mrs. Wilson was the first person to ever be given a what? Come on, anybody? An antibiotic. There you, bingo, you've got it, exactly, penicillin. In that moment, the #1 cause of death in the West was dealt with. And so we developed this concept that for every illness or disease, there is a treatment. You know, right now, infectious disease is not a major cause of death in the first world. It is still a problem in some parts of the third world, but it's not a problem in the first world. And so what happened is we developed this idea that for every disease, there is a treatment. And we call this the silver bullet approach. And if you have an upper respiratory infection or something like that, and you're given an antibiotic, it works wonderfully. As a matter of fact, it changed everything that we thought about healthcare. So what happened with that is we developed this concept that whenever I get sick, I take a pill, I take a drug, I take something to go take care of the problem. And so this works great if you have one problem and you can match one therapy to it. But the problem that we have now is we have 21st century diseases which are complex and they're multifactorial. There are many different sides to it. You take, for example, obesity and diabetes. There's a lot of things going on there. It's not just eat less, you know, push away from the table. There's a lot of things happening. When you look at heart disease, there's a lot of things going on. And this is why the monotherapeutic model, it works great for what we call 20th century diseases, but it is not working well for 21st century diseases. So what we need is we need a new paradigm. So Alzheimer's is not a single disease. Amyloid plaque buildup is the brain's protective response to an attack. Now just let that sink in for just a second. When the brain is under attack, it forms amyloid plaques. Amyloid plaques, think of them, instead of being the problem, think of them like little castles. So what do? You build a castle around something you're trying to protect, okay? Or you build a castle to protect you from someone that is attacking you. So if something is attacking the brain, what the brain does is it will build a castle or a plaque to protect things. This is what happens. This is where the amyloid plaquing comes from. So the brain suffers some type of an injury, and that could be an infection. It could be trauma. It could be an assault or of some type, and it responds by defending itself. Part of the defense mechanism includes decreasing its size or shrinking, producing amyloid plaques to protect whatever is under attack. So the amyloid is actually a part of the protective response. Drug therapy so far has been designed to try to get rid of the amyloid plaques. The plaques are not the problem. The plaques are the indication that something else is happening. Now, while I'm here we've just brought up the topic of brain shrinkage. What you see as dementia progresses is you see people starting to lose certain abilities, right? So you see somebody with advanced dementia or something, they can still eat, they can still go to the bathroom, but they start to lose memory. They lose other types of cognitive functions because what ends up being more important, remembering who somebody is or being able to feed yourself. So just like if you were going to run inside of a castle, let's say that somebody was invading this particular castle's in the south of England, and let's say that some army came across the channel to attack the south of England, all the people would run inside the castle. You would take inside the castle only the absolute essentials. You would leave everything else out. It's like when you're on an airplane and they say in the case of an emergency landing, just get yourself out of the plane, forget about your bags. So this is what happens, and this is why people start to abandon or jettison certain cognitive functions like memory or reasoning or things like that, and they only focus on the things that they have to be able to do in order to stay alive, which is basically eat and breathe. Maybe sounding a little hoarse. Okay. Here we go. This has a profound implication on how you treat the disease. Alzheimer's is not a single disease. Alzheimer's is a result of a protective response in the brain. So if you look at it like that, then what we need to do is we need to find out what is attacking the brain. And this is what Dr. Bredesen and the doctors out at the Buck Institute at UCLA have done for about the last 30 years. And we're going to get to the things that we've identified that actually attack the brain. Alzheimer's does not arise from the brain failing to function as it was designed to. Alzheimer's is actually what happens when the brain responds as it should to certain threats. What happens with Alzheimer's is the brain begins to protect critical function and jettison non-critical functions. The other reason that it shrinks, if you think about if you've ever watched boxing, you don't see a lot of boxing on TV anymore, but if somebody is in trouble, they end up making themselves smaller and smaller to give you a smaller target to go after. Or if one country is losing a war with another country, they will bring all of their troops together in one place to try to defend a smaller piece of land. This is the same thing that happens with Alzheimer's. You end up shrinking the brain down in an attempt to protect what's left. Alzheimer's disease is what happens when the brain tries to protect itself from various things. And we've categorized these things into 6 groups. The first group is inflammatory processes. Now, inflammation can arise from a lot of different things. It can arise from an infection. It can arise from diet. You know, I don't know how much you think about diet right now, but, you know, since the 1970s, we have, especially in North America, not so much in Europe, but definitely in North America, we have eaten very high carbohydrate diets. Carbohydrates, that's a fancy word for sugar. Sugars are inflammatory. What happened is based on some faulty research out of the then Soviet Union in the 1950s, we got the idea that fat causes heart disease. Actually, fat does not cause heart disease. Inflammation causes heart disease. But what happened is this idea took root in the medical community, and we all started thinking that high fat is what caused heart disease. So if you remember back through the 80s, everything was low fat and all this sorts of stuff. And what happened at the time is heart disease wasn't going down. It started going down lately, but that's a different thing. So what happened, we start eating very high carbohydrate diets, thinking this was good for us, driving up our inflammation. And what has happened is you look at the chronic diseases that we have today, and they're virtually all inflammatory in nature. Even autoimmune diseases are inflammatory in nature. Heart disease is inflammatory. Cancer at its root cause is inflammatory. All of these things are inflammatory diseases. You have chemical exposures. We have so many chemical exposures that we never had before. You have the decline in shortage of supportive nutrients, hormones, and other brain supporting molecules. Now, I mentioned the hormones before. The reason that women suffer from dementia at a 2-to-1 rate to men is because of the hormonal changes that they go through during your lives. We have toxic substances in our world like we've never had before, especially heavy metals. We see a lot of heavy metal problems. When we look at a patient, one of the things that we do is we go in and we find out, is there a heavy metal problem going on in the brain? So heavy metals could be lead, mercury, aluminum. Those are the big ones, right? And I even remember when I was a kid, my mom, we thought we were going to be the modern family. And so you stopped cooking with cast iron and you started cooking with aluminum. Well, that was really good. Now we got aluminum in all of our food. Biotoxins are another huge problem, especially molds. Now we see an awful lot of molds here in Northern Virginia. And I grew up in South Florida, which is like the mold epicenter of the entire universe. We see an awful lot of mold problems. What can happen with molds is in the upper part of your sinus cavity, you have your olfactory nerves. And the olfactory nerves are actually a part of your nervous system that are physically exposed to the external environment. So when you breathe stuff up into your nose, it can actually get into the olfactory nerve and back into the brain. We're able to now do something called volumetric MRI, and I'll show you some of those in just a minute. When you run a volumetric MRI, there are certain parts of the brain that when it begins to shrink, and we can see that, you can just bet your life that there's a mold or a biotoxin going on in that part of the brain. So we see an awful lot of that. As a matter of fact, I always joke when I'm doing this talk, when we do it in a live group, what is one of the most toxic environments you can put yourself into? And if I gave you a brand new one today, you'd send me a Christmas card for the rest of my life. Anybody want to guess? Somebody type something in. What's one of the most toxic environments you can put yourself in? Your home. That's good. That's not the one I'm thinking of, but that's good. Matter of fact, carpets are full of formaldehyde, and there's all kinds of other things. How about a new what? How about a new car? That smell of a new car. I always say that's the smell that God loves me, right? It's that smell of a new car. It's success. It's new. It's wonderful, and all these sorts of things. When you're in a new car, you're breathing plastics, formaldehyde, other types of chemicals, adhesives, solvents, and things like that. And then if you spent extra money and got the leather interior, then you get to spend all the chemicals that they treated the leather with. So we get all that kind of stuff going on. By the way, before I go, we'll go to that one, but what's another way that you can get mercury into your body? Anybody? What do you think? Yep, fish is one, absolutely. Give me another one. Anybody? Vaccines, that's true. And this is not even on the agenda for tonight, but if you have a leaky blood-brain barrier, the mercury fillings, very good, Katie. Fillings, if you have leaky fillings, that can get up into your brain as well. That's the one I was thinking of, but all those others are very good answers. I'll go. The inability to regulate blood sugar levels. Now, this ties back into diet. Many of you have probably heard that, dementia is now in some ways being called type 3 diabetes, because you have trouble regulating the blood sugar in your brain. That drives an inflammatory response and so on and so forth. This is the reason that a ketogenic type of diet works so well for cognitive decline. Now, we're not talking ketoacidosis. We're talking about a very mild level of keto is great for the brain because it stabilizes your blood sugar. When your blood sugar is not stable, you get insulin spikes, you get cortisol spikes, you get all kinds of things like that. That is not good for your brain. And then the last one is trauma. And trauma is one of those things that you've either had trauma or you haven't had trauma. The one thing that I did not mention on here is also vascular. Some of you, maybe loved ones or even yourself, but certainly loved ones maybe have had little strokes and things like that. You can have mini strokes, the TIAs, transient ischemic attacks. You can have the big strokes. But if you have a large stroke, you can lose parts of the brain that you can't get back. But even mini strokes cut down the oxygen supply to the brain. So I want to put something in here. This is a very dangerous belief. And yet we've all been told this all the way through our lives, is that memory loss is a part of aging. Memory loss is not a part of aging. Memory loss is common, but memory loss is not normal. We call that a social infection. We've been led to believe that memory loss is a normal part of aging. It is not a normal part of aging. It is a common part of aging. But it's so prevalent that we have little terms for it, like I had a senior moment. But what happens is, if you're experiencing these moments, we joke about it and we try to laugh about it because it keeps us from realizing how serious it is. These are not joking. These are not laughing moments. When you're starting to lose memory, when you go for a word or a name or something like that, and it's just not there, that's a pathway problem. You're not finding that file, and that file should be there. This is an article published, well, it's been a while ago now, out of Rush University Medical Center. Memory loss is not a part of normal aging. Now, I want you to remember in this entire scenario that time is tissue. And the sooner that you address what's going on and find the things that are going on, the easy is not necessarily the best word, but the less complicated, let's call it that. The less complicated and the less time it will take to turn this around. I'm going to play a little clip here because I want to share with you. So I want you to see what a brain with dementia looks like. Well, nope. Well, there you go. I thought it was going to play. Never mind. If you look here on the left, the brain A and B, these are normal brains. And over here, C and D, these are brains with Alzheimer's. These two patients were exactly the same age, same gender, pretty much same weight, same ethnicity, level of education, and everything. The difference between them is one has Alzheimer's and dementia, the other one does not. So what happens is that brain really begins to shrink. Now, what I want to show you, I don't have a pointer that I can use on my mouse, but if you look at the one, say, look at B versus D, for example. On the B side, you'll see the very slight, it's almost like little eyes right in the middle there, those little black things. Those are called ventricles. And they're necessary, but you want them to be small. Now go over and look at the D size. The ventricles are huge. When brain starts to shrink, ventricles start to get larger. So when we look at an MRI, we want to look at not only the brain, but we want to look at the ventricles. Let's do a little terminology, and then we're going to get to the good news. Dementia, now you'll notice I use these words interchangeably: cognitive decline, dementia, Alzheimer's. Dementia is sort of an umbrella term. And under the umbrella term of dementia are all of the different types of cognitive decline. There's vascular dementia. We mentioned that. That's when you start having the small strokes and things like this. There's frontotemporal dementia. This is when people's personalities actually begin to change. When the person that everybody knows as you lives up here in the front of your brain. That's where you live, the personality of you. When you start to lose that part of your brain, that's when your actual personality begins to change. There's something called Lewy body dementia. And this is a type of dementia that is, it's hallmarked when people start having very vivid hallucinations. And I've had patients that have come in like this, and you know, they can tell you somebody's walking across the room, and they're talking to them, and they're pushing a buggy, or they can tell you what they're wearing and everything else. And this is Lewy body dementia. Alzheimer's disease is a form of dementia that's marked by the amyloid plaques. The lines between these different types of dementia, though, are graying. They're not as clear cut as they used to be, because there's always a little bit of overlap. Even Parkinson's disease, which I don't have in this list, Parkinson's disease is a form of cognitive decline that takes place in a specific part of the brain called the basal ganglia. These are the two that I want us to focus on right now for most of us here tonight. And that is something called subjective cognitive impairment, or SCI. Subjective cognitive impairment, that's when you begin to notice that you're slipping. You reach for a word and it isn't there, so you use a different word. Or you go for a name and it takes you a moment to come up with it. Or you go to the fridge and you open the door and it takes you a couple of beats to remember why you went to the fridge. Subjective cognitive impairment is when you notice, but no one else is noticing yet. And it says here, like you can see, it often lasts a decade or so before progressing to the next one, which we call mild cognitive impairment. This is when those who know you can tell, spouse, maybe your kids, maybe your best friends, things like this, they start to notice that you're slipping. Now, mild cognitive impairment you slide from SCI into MCI. It's a slow transition from one to the next. Mild cognitive impairment then moves on into what we would call stage 3 of dementia or Alzheimer's. You have to get all the way to stage 3 before our present diagnostic criteria for labeling dementia and Alzheimer's can give you a diagnosis. By the time you get there, this could be going on from anywhere from 10 to 30 years. We now know that cognitive decline typically begins 10 to 20 years before it is diagnosable using the standard criteria. What we want to do is we want to catch these things years before you get that far. Okay, so what you do is just look at this progression here, and where are you? Now, you don't have to type it in if you don't want to. You can if you like, but you can keep it private. But you know where you are. Or if you're here because you want to learn more about a loved one, mom, dad, spouse, whatever, you know where they are. And this is just a progression in any place from normal and healthy to late stage Alzheimer's and dementia. That progression there lasts for years and years, which if you look at the 3 main causes of death, if you're going to die from heart disease, I don't want to see anybody die, but we all are. If you had to pick one of the 3, you'd want a heart attack. And you'd just quick and it's done. Cancer usually takes a while. It can be painful and unpleasant. But the thing about dementia and Alzheimer's is it lasts for years and years. So now the good news. Who's ready for the good news? This is my favorite part. The good news is, all right, there are survivors of Alzheimer's, okay? So you can pass that on. When you see the advertisements on TV that says we're waiting for the first survivor, it's because they're not looking in the right place. Everybody's still waiting around for a pharmaceutical solution to this problem. Just wanted to show you this. I know from from the questions I asked you when you registered, about half of you have heard of Dr. Bredesen and about half of you haven't. Dr. Bredesen runs the Buck Institute out at UCLA. That's where I went out and trained. And at the Buck Institute, they have identified 36 different things that can drive Alzheimer's. All right. Now, this is, people always ask, well, how much research is there and so forth? There's quite a bit out now. This is one of the first things that was published. This was actually coordinated through the Cleveland Clinic. As we all know, the Cleveland Clinic and the Mayo Clinic, they set sort of the guidelines or the, the leading edge. And so it's really nice to see the Cleveland Clinic doing this. What we have found through the research that we now have, and I don't know how many doctors have been trained in this, but we've probably got more than 30,000 people in these programs that we're doing now, is that if you follow the program, things get better. All right, so what's really going on in cognitive decline in Alzheimer's? Well, how and why is the brain failing? To understand this, we must develop a new way of looking at disease. So we're going to talk about something called functional medicine. How many of you have heard of functional medicine? Good, thanks. Anybody else? Good, thank you for raising your hands. That's wonderful. Okay, functional medicine is it's a new way of looking at the disease process. Okay, there are 3 levels of functional medicine. This is the way that I look at it. First, the thing that we have is something called the root cause. Now, I'm going to use a very just simple example for this. If there were a tack in a chair and you went and sat on the tack, you would get a pain in your rear end, right? So you have a root cause, which would be what? The tack. It would affect a body system, your rear end, your sit-down system, whatever you want to call that, and you would end up with a symptom. Now, we've developed a healthcare system that is trained and focuses on treating the symptom. Anybody know how long the average doctor's appointment is in the United States right now? Anybody want to guess? Anybody? I'm seeing a lot of things, 5 minutes, 10 to 15. Somebody just did it. Tina, you got it. 8 minutes. Now, I know that sounds sort of pedantic, but actually this is the way the system works. Doctors are paid by insurance companies in 15-minute increments. I only have to see you for 7 minutes to get paid for 15. If I see you for 7 minutes, I get paid exactly the same amount as if I see you for 15 minutes. As a matter of fact, in order to be paid for 30 minutes, which would be the next pay scale, next level up, I would have to see you for 23 minutes. I would have to see you for half of the next pay scale. So 15 plus 7 more, I would have to go to 22, 23 minutes in order to get paid for 30. Or I could see 3 patients in 30 minutes. This is the way our system works. I know it's not nice, it's not pleasant, but this is how it works. So what we have now is we have a system which focuses on managing the symptoms instead of discovering the root cause. When you're dealing with something as complex as Alzheimer's and dementia, first of all, there aren't any drugs that make the symptoms better. And we have a system of delivery where doctors are not trained to find the root causes of these problems. And something else that we see in this is we become hyper specialized. And, I look at it like this. If you want to get, if you need heart surgery, well, you want the heart surgeon that does nothing but that surgery. You don't want the fellow that puts in hips or knees. You want the guy that does hearts, or the woman that does hearts. If you need a knee replacement, you don't want the guy that does the appendix. So when it comes to surgery, hyper-specialization is great. But when it comes to metabolic functions, We're finding out that you cannot separate the function of the liver from the gut, from the brain, and all these things. They're all so interconnected that if you only focus on one part, you end up missing the whole picture. And this is very important. So this is functional medicine, all right? Symptoms-based medicine is what we're calling now 20th century medicine. It is based on looking at the symptoms. The problem that we have is most of the doctors are trained this way, and everybody teaching the new doctors, they're all trained this way. So we don't have, it's going to take a long time to shift this to the new way of doing things. The key to reversing all chronic diseases lies in discovering the root cause. So to go back to the example of sitting on a tack, that's the example I always use. I could take a painkiller, and if I took enough of it, I wouldn't feel the tack in my rear end. But the solution to solving the problem is to remove the tack. And that's what we have to do when it comes to these chronic cognitive issues. So what we have is we've discovered the root causes of dementia and cognitive decline. What we have termed them, that we call them the roof with 36 holes. So we've identified 36 different things that can drive or cause cognitive decline. And every person that we see is going to have a combination of these things. As a matter of fact, through the research and everything that we've done, we've found that the average person, by the time they are in mild cognitive impairment, has between 10 and 25 of these holes in the roof. And I'll show you in a minute what they are. Now, if you're going to fix the roof, you have to fix all of the holes. But it's important to fix the largest holes first, or you want to fix the most important holes first. So I say if there's a hole over your bed, you certainly want to fix that one before you fix the one that's in the guest bathroom upstairs that doesn't ever get used. So you have to not only identify all of the holes, but you have to prioritize the order in which you fix them. All right. So these are the 36 holes. And if you want to get, Dr. Bredesen has these in his book. If any of you have read his book, I know some of you've read his book, but and there's a new edition coming out pretty soon. But you can look down those lists of things. You got stuff here. You've got BDNF, that's brain-derived neurotrophic factor. Homocysteine, that's an inflammatory marker. You can come over here. You can see increased insulin sensitivity. Well, that's a big one nowadays with all the diabetes we have going on. As a matter of fact, I'll bet a lot of you have something that we're now calling insulin resistance, especially if you have stubborn weight and you can exercise and diet and it will not come off. I will guarantee you have an insulin resistance problem. Mitochondrial function, that's where you get your energy from. Let's see what else we got. We got all the hormones down here on the bottom left: estradiol, progesterone, those T3s and 4s. Some of you guys have thyroid problems, and they don't just affect your thyroid; they affect your brain as well. These other things over on the other side, you've got inflammatory things, you've got detox. You got to be able to detox. All of these things are holes in the roof. So like I said before, the average person with mild cognitive impairment has between 10 and 25 holes in their roof. So step one, what's step one, folks? Step one is going to be identify which holes you have. How many holes do you have? Or if you're here for a loved one, for your mom or whatever, what we need to do is identify which holes they have. And we actually have developed special lab tests and things that we can do this. We actually have our own panel now at LabCorp that can go in and find these holes. We've had LabCorp create special panels just for us. By running the correct test, we can identify which holes you have. That's really important. Now, once we identify the holes, this goes back to what we were talking about when we were looking at the castle. We can take different holes and put them into certain categories, such as inflammation. Glycotoxic has to do with, what does glyco have to do with? Anybody want to give that a shot? Glyco has to do with sugar, blood sugar regulation. Atrophic, that has to do with hormones and things like that. Toxic has to do with what we were talking about before with biotoxins, mold, pesticides. All these things are toxins. Vascular is when you have blood flow issues into the brain, and we now know that these blood flow problems, they're due to inflammatory processes in the arteries, arterioles and capillaries themselves. And then, of course, the reason that trauma, the number 5 is in blue, is because trauma, you've either had trauma or you haven't had trauma. And if you want to see what trauma can do to people, look at, for example, professional football players. It's really tragic that this has happened, because we didn't appreciate what trauma did at the time these were young men. You want to see what trauma does to somebody, head trauma, what did Muhammad Ali look like, right? You know, how was he doing right before he died? Now, once we find the holes in the roof, we can put them into these different categories. And once we put them into the categories, then we can prioritize the order in which we fix them. Let me get a drink of water. So it's very important to prioritize the order in which we fix the holes. So it's like a two-step process. Find the holes, categorize them, and then put them into the priority in which you fix them. It's very important to start in the right place. So here's some red flags of neurodegeneration. And this is up here mostly for you, for those of you who you're not that far along, or you're here for a loved one, parents, spouse, somebody like that, and you already know they're going that way. But these are things that start to creep up on you, and we start to think, oh, it's just normal, that's no big deal, I'm just getting a little older. You need to catch these things early. Don't let these things go. Brain fog, mental fatigue. Now, the difference between mental fog and mental fatigue, if you've experienced mental fog or brain fog, it's like the window is dirty. Your brain it's just not quite running the way you know that it should. Mental fatigue is when you can't do something for as long as you used to. I grew up in South Florida. I went to college in Texas. It was 21 and a half hours from my dorm to my house in Florida. I would think nothing about driving straight through the night. That's 21 hours. Wow, that's no big deal. That's what you did. Now I wouldn't do that, right? If you read and you can't read for as long as you used to before your brain, before you start to lose your focus, that's mental fatigue. Decreased sharpness and or recall. And that's a little different. That's when you can't process as well as you used to. Forgetting words, faces, names, etc. Think about it like this. There's a part of your brain called the hippocampus, and the hippocampus is one of the main places where you make memories. So you make a memory, and then you have to go file that memory somewhere. You might be able to make the memory, but you can't find the file anymore. So, or you go down the hallway, you can't remember which room the file is in. That's when you start to forget words, faces, and names. It's a little bit different. It's not just memory, but it's not being able to access stuff that you know. Difficulty recalling recent events. You should be able to think back over the last several days and remember every single thing that you did. Depression. Depression is a very strong clinical indicator of neurodegeneration. It's very, very strong. This is not something don't just take medication for this. We now know, when I was in school, we were taught serotonin. Serotonin is a neurotransmitter. Serotonin is a very influential neurotransmitter when it comes to depression. When I was in school, we were taught serotonin was made in your brain. We now know, as of last year, February last year, we now know that 95% of your serotonin is made in your gut. 70% of your dopamine and 70% of your GABA are made in your gut as well. Visual issues. Now, we tend to think of vision. Most people, when they think of vision, they think of acuity or the ability to focus on something. And that's why you would wear glasses or contacts. But it's not just the ability to focus, but it's the ability to differentiate contrast. The part of the brain that is very susceptible to biotoxins, especially mold, is part of the brain where you are able to process contrast. And so one of the things that we do when we examine people is we run something called a VCS, or visual contrast sensitivity test. It takes about 15 minutes, and you can get a really, really good picture at how well that part of the brain is functioning. It's a part of the temporal lobe. Loss of smell. Now, I'm going to bring this on up with the next one as well. When you start losing the sense of smell, that is a profound indicator that is so often overlooked. And also constipation. And, a lot of people are told by their doctors that going 3 or 4 times a week is normal for you. No, it's not. It might be the way you've been, but going 3 or 4 times a week is not normal. If you eat every day, you go every day. That is the primary way that your body gets rid of toxins, gets rid of the things that build up everywhere. And most importantly, for what we're talking about now, toxins that build up in the brain. Your intestine is a compromise. Let's put it like that. Your intestine is designed to absorb what you eat and get rid of what you need to get rid of. Primarily, your liver dumps the junk in there that it's detoxifying from you. When stuff stays in you too long, you are reabsorbing what you're supposed to be getting rid of. So it's like you're not carrying out the trash. If you're going more than 3 times a day, stuff's not staying in you long enough to be efficiently absorbed. So digestion, as far as this goes, is kind of like a boat with a hole in it. As long as you can bail the boat faster than the boat leaks, you're ahead of the game. But when the boat starts to fill up, you're losing the game. Also, the loss of smell and constipation are the 2 earliest signs of Parkinson's disease. We all think of Parkinson's disease relative to the tremor. You see the tremor and or the gait that goes along with it. But by the time you get to tremor and gait changes, this degeneration has been going on for years. So reversing Alzheimer's disease depends on early detection. So let me show you some of the very best tests for the detection of Alzheimer's disease. The first is called a CNS, Central Nervous System Vital Signs. The second is something called a Cambridge Brain Sciences test. And the last one is called a volumetric MRI. I'm going to show you what these are quickly, and then I'm going to give you a chance to get a Cambridge Brain Sciences test run, complimentary. We partnered with Cambridge Brain Science, and they're making these available to all the people that are in my webinar. So this is a CNS Vital Signs, and what it does is it goes through and it measures all the things that you see on the left, composite memory, verbal memory, motor speed, reaction time. You can see this, cognitive flexibility, and so on and so forth. And it will put you into a percentile, and then it will show you graphically how you lay out. So let me show you one here. This is a particular patient of ours, and you can see that this was done on June the 11th, 2019. So it was just done last June, this woman. And you can see that her overall cognitive index at that time was the 4th percentile. And you can run down there. I highlighted them in yellow. Now, if you go below and you look at the one below, you can see that her cognitive, her overall neurocognition index as of March the 3rd, just 3 weeks ago, is now at the 50th percentile. Now that's compared to her age group. All right. So she was in the 4th percentile. That means 96% of the people her age, their brain was working better than hers. Now she's at the 50th percentile. you'll see that she doesn't have any readings in the low or very low. We see this happen with our patients all the time. This stuff can be reversed if you find the holes and fix the holes. Now, the next one is the Cambridge Brain Sciences. And this is developed by a neuroscience fellow out of Cambridge University. And this is this is one we're going to send you. You can take it at home. You can do it on a laptop. You can do it on your iPad. You can do it on your desktop if you want to. So it just runs you through. It gives you little tutorials about how to do this. This is an amazing thing. Yeah, thank you. Yes, that was amazing improvement. Thank you for writing that. It's absolutely, when I show this to my doctor colleagues, they can't believe it. The Cambridge Brain Sciences, it gives you a printout that looks like this. It's different than the CNS VS. They're both good tests. They're a little different. But this goes through and it looks at different things. Visuospatial, working memory, response inhibition, all these things here. And what you can see is it goes through and it will rank you. Now, this is what we're going to make available to you if you want to do this when the webinar is over. You can do this at home. It will tell you what each test measures, like the double trouble or the feature match. It looks at a certain kind of brain function. And then what you can do is you can run this test over and over as you're working on reversing the things that are causing the problems. And you can actually see over here on the right how it will plot out your improvement. So what we like to do is we like to find the holes, prioritize how we're going to fix them, then start testing, because if we're doing the right thing, then these things should be getting better. Each time we test, things should be getting better, and this is what we see. The last one I want to show you is something called a volumetric MRI. Now, most people are used to looking at MRIs. They're just these shades of gray that are very difficult to make any sense out of. But what a fellow out at the University of California, San Francisco, a neuroradiologist, developed this software that will go through and reconstruct different parts of your brain, and we can look at their volume. So we can look at the volume of your part of your brain compared to someone else, your age, your gender, your race has to do with it. Even your native language can have something to do with the way different parts of the brain develop. So you can see here, the places that are blue, her brain is doing great. And the places that are red, that's between the first and the fourth percentile. But don't just look at the red ones. Look at how many places she's at the 9th percentile, 5th, 8th, 13th, 7th. I don't like to see anything below the 40th or 50th percentile. Because what we know is that by age 65, 1 in every 3 people is developing dementia. So if your numbers are getting down there below the 40th percentile, you're in the category that's developing dementia. We do not want that. So we can run these things and we can start to find these problems before they're diagnosable even. Now, so we look at one thing is we want to see how is your brain compared to your demographic. But we also want to look at how is your brain right side compared to the left side, because that can help us to pinpoint which holes in the roof that you have. The great thing about this is now we can accurately measure brain volume in the specific areas associated with cognitive impairment. And this allows us to detect Alzheimer's and dementia development up to 30 years before the old way used to be able to do this. This is just amazing. Amazing stuff. This is just another version of this test. And you can see it will lay it out not only in a chart form, but it'll also do it as a graph. The only consistent in cognitive decline, regardless of type, it doesn't matter if it's Alzheimer's, Lewy body, Parkinson's, vascular, the constant in all types of dementia and cognitive impairment is the brain is shrinking. If we can identify the shrinkage early and find the holes, we can turn this stuff around. The only way to detect cognitive decline in Alzheimer's before symptoms begin is with a volumetric MRI. This is the coolest thing. We actually have made a special arrangement with Washington Radiology in Fairfax where we can get these run at a really, really reasonable rate. So how do you prevent Alzheimer's? Well, the first thing you have to do is you have to figure out where you or whoever we're talking about is on the timeline. Then we have to identify the 36 holes in the roof. And we do that by running the specific labs that we've talked about. They're blood labs, saliva, stool. We even check your hair because hair is actually a really good marker for chronic heavy metal exposure. We design then a protocol that corrects each hole in the roof in the correct order. So we have to look and say, which holes does a person have and in what order do we need to fix them in order to have maximum impact? Now, here's some things you can, or when we do our program consists of all of these things: the CNS VS computerized test and also the CBS, the Cambridge study. We do the visual contrast test. We do the volumetric MRIs for most people, as long as you can do an MRI. We do all of the lab testing that we need to find, to find the markers for the holes in the roof. We do biotoxin and heavy metal testing. We have very special testing that we use for that from a company called Quicksilver. They're very good. We also want to check your adrenal and cortisol production to see if that is driving any of the inflammatory response going on in the brain. We like to use a ketogenic diet because it gets blood sugar regulation under control and it brings inflammation down. We also use Brain HQ. Now there's a couple of, Brain HQ is a web-based brain exercise thing. And we like that with Lumosity. I always want to say luminosity, but it's actually Lumosity. We do that, and actually for my patients, I put them into my group and I can go in and I can see how they're doing. You want to do something called high intensity interval training. It's very important because it creates certain hormones and chemicals which are really good for the brain. We do a personalized supplement protocol depending on what holes need to be fixed. There is no one supplement that everyone needs. Everyone needs supplements based on which holes you're trying to fix. We need stress reduction. Stress is a big, big problem with a lot of people, especially in this Northern Virginia part of the country where there's a lot of stress that people work under and so forth. Blood sugar regulation. If you've got diabetes, it needs to be reversed. And I don't mean this in a flippant sort of way, but if you know how to do this, diabetes can be reversed in 3 to 4 months in almost everyone with diabetes. It's not that difficult if you know how to do it. Sleep is so important. You should be getting between 7 and 8 hours of good quality sleep every night. And then you need to do the follow-up testing to make sure that you fix the holes and that they stay fixed. Now, what can you do at home? All right, so just if you want to write some things down, you can adopt a ketogenic diet. It's a great way to eat. When I first thought about it, I thought I can't do that, but actually that's the way I eat now. Intermittent fasting. You can read more about intermittent fasting. I like to see people do what's called an 8 and 16, where you eat in an 8-hour window every day and you don't eat for about 16 hours a day. It really helps if half that 16 hours is when you're sleeping. There's the sleep again. We talked about that. You need to be getting good sleep. Sleep is when your body carries out the trash and does its repair work. You need to optimize hormone production, especially your thyroid. Your thyroid isn't just about your thyroid. It runs your metabolic activity level everywhere. You need to make sure your gut's in good shape. If you have a leaky gut or neurotransmitter production problem, you've got to optimize that gut health. You can adopt high intensity interval training. You've got to reduce your stress. And right now is not a great time to talk about reducing stress, but you really, really need to. It's easy to say, and it's not necessarily easy to do, but there are ways to do it. Yoga, meditation, going for walks, things like that. do a cognitive brain-based exercise like Brain HQ or the Lumosity. If you end up wanting to be a patient of mine, I will put you in my group, and we can monitor it as we go along. You use supplements that reduce inflammation. Now, this is a huge group, but I'm going to tell you that's polyphenols and flavonoids. You can read about those and find, and see what fits into those categories, but you can't make any generalized supplement recommendations other than those categories. You need to get tested. You need to be tested, because if you don't test, you don't know which holes you have, and you're just guessing and hoping that you get it right. So has this been insightful for you guys so far? Anybody? Give me a hand. Thank you. All right. That's great. I appreciate it. This is so much different than doing a live workshop, because I can't look at people's faces and see how they're responding. All right. So back to the question we had earlier. If there were a way to prevent Alzheimer's disease and cognitive decline, would that be important to you? Absolutely. I'm sure all of you are going to say yes. So go back and look at your number. How important is this? I know you all put your numbers in there. Okay. So what to do now? The first thing to do is determine if you already have subjective cognitive impairment, mild cognitive impairment, or if you're moving beyond that. How? Well, you run the best test for the early detection of Alzheimer's, and those are either a central nervous system vital signs, a Cambridge Brain Sciences, or a volumetric MRI. So I'm going to go on to the next screen, and I'm going to show you what we've done for you. We've partnered with Cambridge Brain Sciences to provide everyone who attends the webinar a complimentary cognitive assessment test. That's really cool. All right. Your brain's destiny is in your hands. So let me show you how you do this if you want to do this. And there's no downside to doing this. You should all do this, okay? What you do is you do this. You go here to this link right here. It's https://bit.ly/Dr. Glenn CBS, Cambridge Brain Studies -test. And if you punch that in, it's going to look like this. Now, did everybody get that? Does anybody need me to go back? Okay, let me go back. Whoop. Okay. Write that down. bit.ly Dr. Glenn CBS test. I'll give you a few seconds to write that down. And if for some reason you don't get it, you can send us an email at support@drgarlandglenn.com, and Lenine can send that to you tomorrow. But go ahead and write it now. Yeah, bingo, there you go. Oh, you pasted it in there. Now people can hit the button. Thank you, Christine. I'm not that tech savvy. Okay. All right. Is everybody okay now? Great. All right. So let me show you what's going to happen. You're going to go to this page. All right. You're going to fill in your details. Now, these are kept private, and you're not used to giving this much information, but we need first name, last name. We need an email address, a phone number, and I need your birthday. And here's why. I need your birthday so that your results will be looked at through your same demographic. All right. Otherwise, you'll be compared to the general population. And if you're 72 years old, you don't want to be compared to a 32-year-old. Or if you're a 32-year-old, you don't want to have the older person mixed into the average. So that's why I need your birthday. All right. And what will happen is everyone that signs up, we will load up the information tomorrow, and you will be sent a link that you can use to go to Cambridge Brain Sciences and take the test. And when your test is done, then you will get results. And if you want to go through the results with me, great, we can set that up. But you don't have to, but it would be, you're probably going to want to discuss whatever is in there. All right. And let me see if, thank you. All right, I'll just go back and leave it there. Does anybody want to ask me any questions before I head for dinner? Go ahead. You can type them there in the chat and I'll do my best.